All right, let's talk to Roland Wilson in Incheon, South Korea. He is a program coordinator and professor of conflict analysis and resolution at George Mason University in Korea. All right, Roland, good to have you. So when you hear these statements from the WHO and evidence of any kind is hard to come by from North Korea, why do they believe that it could be a severe outbreak? Is there evidence of this?
Well, I mean, there's circumstantial evidence. We've seen that very few countries around the world has been able to prevent from the COVID spreading throughout their population. We've known for a year, the last 2 years in North Korea as well, that there has been cases, but yet the ability to get in and see those cases and how much is actually spread around the country is actually anybody's guess. I would submit to you, though, that probably the numbers are at least double, 3 times, even maybe much higher than it is being reported right now.
Oh, that's incredible to think. Triple the numbers that have been reported, which are also quite high. And remind us why North Korea has no vaccines and no tests.
Well, I mean, there's so many different reasons. We could say at the medical level, there's very, very few medical assistants really in North Korea. The hospitals are without vaccines of any type, let alone the COVID vaccine. The best that the Kim regime could do at the moment 2 years ago was to really close down what little much they had open within their country itself, which then prevented any possibility of the South Korea, the United States, WHO, or even China from providing assistance with the vaccination of their population. So that compounded on top of a very unhealthy sick population. Now we're going to deal with drought this year. Could be the worst drought within 40 years or so within North Korea. All these things combined has really made this vaccine issue and the epidemic much, much more severe, I believe, within North Korea.
And as you alluded to, poverty is a major issue in North Korea. Malnutrition. I mean, people with pre-existing conditions we know are more susceptible to getting severe symptoms of the virus. So when you think about what could be happening there that the world just doesn't see, you understand, the threat of this to people.
Absolutely, absolutely. If you go outside of Pyongyang into the province areas, there's very little in the form of any hospital. So therefore, if I were roaming along the countryside, we would probably see very unhealthy, if not already, North Koreans that has been passed away because of this COVID virus. The only thing North Korea can really do at the moment is to lock down even further the population, which doesn't really prevent the spread. It just keeps the spread from necessarily moving from village to village, which is quite sad to know, actually.
And of course, vaccine distribution has been a problem worldwide, but they have been available through the WHO. Why would Kim Jong-un not want to bring in at least some vaccines, including from China?
Sure. I don't know. I think maybe he will eventually. I think that probably one of the reasons is it's anything that they can do to control the population. And of course, when you have vaccines, you can also control the population even further. It sounds pretty severe in how to control your population and allow part of your population maybe to suffer or be sick. But of course, that's part of the overall structural violence we see North Korea conduct against the citizens around the country. I believe probably there will be some vaccinations get in there. Hopefully that they will eventually take the offer of South Korean to provide vaccinations to the North Korean population as well. Hopefully, China will then start to prevent it or provide it as well. But of course, China is dealing with their own outbreak within the country. So maybe WHO, South Korea's lead to provide some of this vaccination that they may need. And at the same time, actually, this could be an opportunity to really reapproach North Korea and try to create some type of relationship with them, as we really had in the 1990s when they had the number of events that happened throughout the 1990s.
Right, of course. That's a good point. And it's fascinating to think this is all happening at the same time that the North Korean leadership keeps touting its constant advances in weaponry, while, of course, its population is suffering. Roland Wilson, really good to talk to you. Thanks for joining us.
It's a pleasure.